Hello everyone, I am Dr. Prachi Kulkarni, fertility specialist, 49 Fertility Center, Banjara Hills. Today I will talk about how to do a semen analysis. Semen analysis is a basic test for male infertility evaluation. After 1 year of marriage, if the couple is not able to conceive, they should visit and consult a fertility specialist and get husband and wife both evaluated at the same time. So what we do in semen analysis is we give instructions to the patient that he should have abstinence period of 3 to 5 days and the sample collection should happen in a fertility center. So once the patient is in the center, we advise the patient to go to the semen collection room. We give them a sterile container. So this sterile container is open only when the semen analysis sample will be collected. Patient is advised to wash his private parts with soap and water, and then ideally he should collect the semen sample in this sterile semen container, which is then handed over to the andrology lab in the center. So andrology lab in the center, they will observe this semen sample first for liquefaction, appearance, the color of the sample. They will see the volume of the sample. Then they will wait for liquefaction. They note down the time of liquefaction. Then they do the process of semen analysis. In that, they will also prepare one slide to check the sperms. So sperms are checked on something called as Mackler's chamber. They measure the sperm count, the motility of the sperms and morphology of the sperms. So these are the major parameters which we check in a semen sample: sperm count, motility and morphology. So sperm count, we mention it as per ml. So normal sperm count according to the latest WHO guidelines is more than 16 million per ml. And motility, which is there are grades of motility. So rapidly progressive, progressive and non-motile. So rapidly progressive motility should be, that is A plus B should be more than 32%. So that is normal sperm parameters. For morphology, what we see is, this is a semen report. So what is mentioned here is the volume of the semen, then the appearance of the semen, pH of the semen, liquefaction time, then count is mentioned over here, then the motility is mentioned, and this is the morphology. So what do we mean by morphology? The structure of the sperm, the head, body and tail. If all three parts are normal, then the sperm is marked as a normal sperm. So out of 100, at least 4 sperm should be normal, which is 4%. So morphology, at least 4% or more is the normal semen parameter. If there are any defects in the head, they will mention it as head defect, mid-piece defects and tail defects. So morphology is the one which we look at the structure of the sperm and we mention it on the report. So this is a normal semen report. So now coming to what is abnormal semen report. So whenever we report an abnormal semen report, what we look at is there can be problem with the sperm count. If the number is less, then it is called as oligospermia. Oligo is less number. Then motility can be another issue. If the motility is less, it is called as asthenospermia. Astheno means less motility. If the problem is with the morphology or structure of the sperm, then it is called as teratospermia. So there is always a combination of these things. There may not be only one parameter which is affected. So whenever we see the semen report, it can be mentioned as the combination, like oligoasthenospermia or teratoasthenospermia. So these are the combinations. The less number with less count is called oligoasthenospermia. Less number with abnormal morphology is called oligoteratospermia. Less motility and less morphology is called as asthenoteratospermia. So oligospermia is sperm count less than 15 million. If it is less than 5 million, then we call it as severe oligospermia. So less than 5 million is severe oligospermia, but less than 15 million is called as oligospermia. Now coming to what are other abnormal semen reports. So zero sperm count is called as azoospermia. So azoospermia is zero sperm count. So when there is azoospermia, it could be either obstructive azoospermia or non-obstructive azoospermia. How do we know it? we advise further tests. There can be some hormonal evaluation, some ultrasound which is called as scrotal Doppler ultrasound, which will measure the volume of the testes, which will also measure the color flow or the blood flow to the testes and rule out varicocele. Also, it can rule out some infections if there is any thickening, inflammation or swelling in the testes or epididymis. So this ultrasound scan is also advised. Some patients we advise to go for some genetic testing also, like karyotype investigation or Y chromosome microdeletion test. So these are the various tests which may advise if we find azoospermia or zero sperm count. So this was about semen analysis. I hope this was helpful.